Now, how common and dangerous is lung cancer, you would say?
Well, Ty, I'm going to read you some numbers from the American Cancer Society that were provided to me today by representatives from the American Cancer Society. In the year of 2023, it's estimated to have 238 new cases of lung cancer. And as far as how serious it is, it's estimated that we'll suffer in the United States 127,000 deaths. I mean, those are some really big numbers. But to take it even more personal, as far as Mississippi, in Mississippi, we're looking at 2,830 new cases of lung cancer, 1,740 deaths. Now, those numbers are very alarming to me because lung cancer is the number one cause of death from cancer, more so than prostate, breast, and colon all combined. So it's very, very serious that people get screened for lung cancer.
And of course,
people that are high risk.
Right. Of course, we don't want those numbers to increase. So who should be who should be screened, excuse me?
Right. Now, note that I said the individuals that need to be screened right now are the high-risk patients. And these patients are being identified as being of age 50 to 80 years of age, smoke now or have quit within the last 15 years, or have what's called a 20-pack smoking history. And that means they smoked a pack a day for 20 years, or maybe they smoke half a pack a day for 40 years, or maybe they smoke 2 packs a day for 10 years. But they have to have that high frequency of smoking history, and at least 15 years have gone by where, they've smoked within the last 15 years, and they have to be 50 to 80 years old. These are the guidelines that are represented as identifying individuals as high risk and need that screening. And the screening is a low-dose CT scan, and it's very, very effective at identifying cancer so that an individual that might get screened, and note that these individuals that get screened, these are individuals that don't have signs or symptoms, meaning they don't present with, say, extreme coughing, blood in the sputum, fatigue, and all the warning signs that they might have lung cancer. These are people that don't have any significant symptoms. It's so important that these individuals get screened, because if you can diagnose lung cancer in the early stages, before it's had time to grow and spread to other organs, there's a much higher probability that treatment can be successful. Because if lung cancer is diagnosed in the later stages, then there's not a very high probability that that person will live very long. So that's why this is such an important segment.
Right. Early detection, of course, is so important. So with that, Dr. Quinn, are there local facilities where patients can be screened right here in Mississippi?
Most definitely. UMC has a very wonderful program. They're very aggressive. I've been communicating with their personnel. We're going to start referring patients over that are identified as high risk. But also, I did speak to him about people that live in cities outside of Jackson that are far out, say maybe the coast. They have it there in some of their hospitals, and even in North Mississippi. But the best thing to do is for individuals that are watching this programming, if you have a high history of smoking, you're 50 to 80 years old, talk to your medical doctor about being screened for lung cancer, and note that it's covered on the majority of insurances, including Medicaid and Medicare and private insurances. So there's no out-of-pocket expense. But talk to your medical provider, and if you have a husband or an auntie or cousin, encourage them to talk to their medical providers, because if they do have lung cancer, if it's diagnosed early, there's such a high probability, or a higher probability, drastically higher, that treatment can be much more successful, and it can be the difference between life and death.
Right. And again, early detection is key.